I always like to start my presentations off by kind of giving you a teaser and a did you know. Did you know that starting at around the age of 35, testosterone levels in men between the ages of 40 and 70 decline by about 2% per year, and men considered to be in quote good health generally maintain levels 10 to 15% higher than men in poor or average health. And again, this is in men aged 40 to 70, and I always ask, well, what about younger men? Hello. But there is a clear-cut correlation here between declining testosterone levels, declining hormonal levels as men age, and the impacts that it can have on health. And we'll be talking about some of those today, and you'll see a reminder of this slide later on. When I start diving into looking at hormones, I always describe this to my patients, and feel free to please use this because I've been using it for a long time, explaining the three main hormone centers in your body. Of course, there's a whole slew of hormones, and we're going to be talking about a bunch of them today with respect to metabolism, looking at insulin and glucagon and a variety of others. But, obviously, essentially you have your HPT axis here, your thyroid, you have your HPA axis, your adrenals, and then of course down here you have your male or female hormones, depending on who you are. And I always draw these things with a double-sided arrow, meaning each one of these hormones is impacted by the other. And especially as we age, a lot of the functionality of some of these hormone systems don't work as well as they once did. And or if there's some kind of clinical issue going on where there's deficiency of these particular hormone systems, then usually what happens is that oftentimes the other hormone systems have to pick up the slack, right? And so sometimes what we see in clinical practice is if one system is out of whack, a lot of times multiple systems are out of whack because unfortunately they have to also pick up the slack. And in the middle of this triad, I put nutrition and vitamin mineral status at the top of what the things that can potentially impact these different hormone systems. And obviously we're going to be looking at metabolism and nutrition a whole lot today. And as I've gotten deeper into my practice over the last 14 years, I've realized that a lot of my hypogonadal men who come in to see me have some of these nutritional imbalances going on and or even pre-diabetes or insulin resistance. That's definitely been an area of focus of mine over the last five or so years, and that looking at these relationships and understanding how to be able to help them better. Of course, gastrointestinal health, looking at the state of one's gastrointestinal barrier, making sure that it's functioning well is extremely important. Inflammation, and I'm sure you guys study this as much as I do, looking at the relationships between inflammation, of course, and how that inflammation can affect the hormone systems, and then, of course, how those deficiency of these hormone systems can then impact the inflammatory pathways as well. And then a whole variety of lifestyle factors can, of course, make or break some of these hormone systems, how much we exercise, how much we sleep, how much we're stressed. None of us have stress, especially, post-pandemic world. I'm sure none of us have stress. Environmental factors, I put this towards the bottom of this triad, or at least the things that affect the triad. And our environment is definitely impacting us more and more these days, and we need to understand those relationships of how the environmental factors are also affecting our hormone systems. And then lastly, I put genetics on here. Genetics definitely play a role in this. Maybe not as much as we once thought they did, but they certainly are contributory factors. So it's clear that testosterone and hormone levels decline with age. And there's also mounting evidence that the average population testosterone levels and other facets of men's health, including sperm counts and other markers of health, are also declining steadily by the decade as well. And this particular study here looked at population average testosterone levels in same age men, and they found that they dropped about 1.2% per year, or 17% cumulative from 1987 to 2004. So these are important things. Again, a lot of guys are like, I felt great when I was 25. I felt great up until I was 30. And then something just kind of over time, I just started noticing that I had less energy and less sex drive and less motivation. We'll be talking about some of those symptoms later. And that part of that is because this is declining over time. It's consistent with similarly observed population declines in sperm counts and quality of sperm over time, increases in testicular cancer, hypospadias, and cryptorganism, which all comprise the testicular dysgenesis syndrome. So it is clear that our male population is now starting out older. That is very important. And more Men younger than 40 now are experiencing symptoms of androgen deficiency. So this used to be a condition of older men, and now that's just not true. I see a lot of younger guys coming into my practice who have similar issues, and we have to understand what is going on here. What is going on? Of course, it's not just one thing. And that's always the damning thing about clinical practice, but also the fun thing too, because you get to dive into the cases and try to really understand what's happening with your patients. But it's a multifactorial process. I think lifestyle factors and poor nutrition, and now what we are understanding, metabolic dysfunction, all are contributing in a big way to our hypogonadal patients. And even more importantly, our environment and environmental causes are wreaking havoc more than ever. And that really, I think, is one of the biggest things that we're seeing, unfortunately. A lot of these chemicals that, unfortunately, that we're taking into our bodies every single day via inhalation or through our skin or from our food, a lot of them are considered hormone disruptors. And so some examples of these are phthalates that are found a lot in our plastics and plastic water bottles, our bisphenols, including bisphenol A and other bisphenols. It's found a lot in our the lining of our cans and a lot in our plastics as well. PCBs, which of course are ubiquitous in our environment, especially in our waterways and our ocean. And so we're getting a lot of our PCBs from the fish that we're taking in, unfortunately. Glyphosate, which is of course Monsanto's creation, or at least part of the products that he created over the years are part of his creation. And now we're being linked to, of course, a lot of different types of hormonal disruption and also really serious forms of cancer, including lymphoma. DDE and DDT, of course, these things are not really sprayed anymore, but they're found ubiquitous in our environment and they're not going away. They're not biodegraded over time. And of course, they end up in our waterways and end up in our in the groundwater, and we take them in every single day. And that's just unfortunate. And the other thing is that there's only a certain number of chemicals that have been studied thus far in looking at the potential impact that they have on not just testosterone production, but of course in many different forms of endocrine disruption. And we have to ask and wonder how many are out there that we haven't studied, right, that are causing similar effects. So what is an endocrine disruptor? An endocrine disruptor is an exogenous substance, something that we take in from our environment that alters the function of the endocrine system. Consequently, it causes adverse health effects in an intact organism or its progeny or subpopulations. And again, that's an important note. A lot of these things, unfortunately, are not just causing problems with us, but also, kind of what happens and what's translated down the line epigenetically. And that's kind of what we also need to be thinking about too. The most important thing here is that, of course, endocrine disruptors can influence susceptibility to a large host and range of disease and disorders, from congenital malformations to growth and metabolic disorders, including overweight and type 2 diabetes, fertility problems, neurological disorders, cardiovascular disease, definitely cancers, hormonally sensitive tissues such as the breast, prostate, testes, thyroid, and many more. And of course, that'll be the focus of our talk today, is looking at the relationship of endocrine disruptors, specifically on the HPG axis. Most endocrine disruptors are classified as xenoestrogens. So these are estrogens that are not made in our body. They act as estrogens, and we're taking them directly in from, again, the things that we're breathing in and putting in our skin and ingesting every single day. And some of them, of course, can inhibit androgen production and function, and also just basically accumulate estrogen directly. So that's not a good thing. And one thing I always talk about when it comes to environmental medicine is looking at these low dose exposures on a daily basis. I think the old rule of thumb was, well, we're getting them in such low doses, it doesn't cause any problems, right? Which is just not true, because this is daily low dose exposure in addition to all of the other things that we're accumulating in our body on a daily basis that do affect our physiology, that do affect our hormone systems. And so this does not follow the rule of the effect of poison increases with the dose rule. We're getting small amounts, even micro amounts, but they're building up in the system over time. And a lot of them cause disruption even in small amounts. And that really is the thing we have to remember about these endocrine disruptors. So when it comes to looking at the endocrine disruption in men's hormones, let's look at a couple of the most important ones. I would say there is a direct inverse association between PCBs and serum testosterone levels. And again, PCBs are coming primarily from ingestion. They definitely bind onto fat very well. So they're found in our fatty fish. And they're found a lot in the waterways, unfortunately, because decades ago they just dumped tons of PCBs into the ocean, and they have never gone away. So the findings, of course, in this relationship are varied amongst the different studies, but several studies have found that PCBs were associated with total testosterone levels, while others have found relationships between PCBs and only the free or bound fractions of testosterone. Well, either one is important, in my opinion, because there's still some kind of relationship, and this has been studied a bunch. So PCBs can absolutely affect the HPG axis without a doubt. Then we have our BPAs and other bisphenols. I would say that BPA is not the only BP out there. And just because something says BPA free doesn't mean that it's BP free. So there's other BPs that do exist that can cause similar problems in human beings. And these BPAs and other BPs are considered to be anti-androgenic, meaning that they, of course, impact our androgen production or testosterone production, and also xenoestrogenic. So we're getting kind of a double whammy there, unfortunately. EPA has been shown to be associated with significantly lower total testosterone levels in male adolescents. And again, so you wonder where some of this is coming from. Well, this is a big problem. BPAs are all over the place. So this is something we really have to be thinking about, especially when it comes to our younger patients. Multiple studies have looked at the inverse association between DHEP, which is one type of phthalate. There's many, many more, but this is one that's found quite a bunch in our environment, and other phthalates and hormone disruption. This is one study that looked at 74 male workers of a polyvinyl chloride flooring factory. They had significantly higher levels of phthalates in their blood and lower levels of free testosterone compared to unexposed workers. So again, this low level exposure that we're getting every single day to these microplastics that exist all around us, unfortunately, potentially can have some big time impacts downstream on testosterone production. So these three in particular, I would say, are the things that we can really help our patients with the most, because a lot of these things, it is truly about avoidance. We're not going to be able to get rid of or completely have these things not enter our body. It's just truly kind of impossible at this point in time. But it is about avoiding them if we can, right? So how do we minimize exposure as much as possible? And a lot of that starts in our home. It starts with cleaning up our water supply if we can. It starts with getting a good quality air filter. It starts with not licking receipts from the grocery store, which of course are quite high in BPA. It starts with avoiding different types of fish. So avoiding especially farm-raised fish, which are extremely high in PCBs. If a patient wanted to do one thing to avoid PCB exposure, it would be to avoid farm-raised fish at all costs. And then, of course, cleaning up the food supply as well. If patients can afford it and it's doable, making sure to eat organic butter, because a lot of the non-organic butters, unfortunately, do have high levels of PCBs because they love fat so much. And then, of course, consuming grass-fed and grass-finished meats. 100% grass-fed meat would be ideal, as a lot of the non-organic meats do, unfortunately, have quite a bit of PCB content too. Phthalates, avoid drinking out of plastic water bottles, especially the ones, the squishier that they are, the more microplastics that unfortunately leach into the water that we're drinking. Do not microwave anything in plastic containers. Maybe we shouldn't be using microwaves at all, but definitely don't microwave plastic. That is not a good thing. And then shower curtains, letting them off gas. If you are using a plastic shower curtain, every single time the hot water steams up in that shower curtain that's brand spanking new, that has that amazing plasticky smell to it, is leaching, unfortunately, and you're breathing it all in, and that's not a good situation. So letting that shower curtain off gas if you can before putting it up on the rings. And then, of course, BPA and other BPs, avoiding plastic and purchasing BPA containers and BPA-free containers and food products. And of course, washing your hands after handling store receipts too. All right, so then, of course, we need to open up the emunctories, as we call them in integrative medicine. So how do we get this stuff out? And I would say the number one way to get a lot of these things out, because they are fat soluble, is sweat. Sweat every day if you can, or have your patients sweat every day if they can. If they can do far infrared sauna, that can be very, very helpful. Even better is Finnish sauna. That can be extremely helpful to mobilize some of these things out of the body. And again, if they can continue that sweat and purge, it's very, very helpful to get some of these things out. Colon hydrotherapy is also extremely helpful. It's something that we do recommend for our patients regularly to help to remove these things from the colon and prevent them from backing up. Activated charcoal, of course, can help to bind up some of these things, especially after some of these other therapeutics like sauna and colon hydrotherapy. And then, of course, taking antioxidants on a daily basis. The number one antioxidant I'd probably recommend is NAC. NAC does very well in helping to convert into glutathione, which of course is our major free radical scavenger in our body and can work very, very well. So I would highly recommend taking NAC. I don't talk about NAC again throughout this lecture, but I would typically be recommending 600 milligrams BID twice a day to TID, depending upon somebody's level of toxicity and what you're trying to accomplish. ALA is one of my favorite nutrients, alpha lipoic acid, and another just amazing powerhouse antioxidant. It attacks both things that are fat soluble and water soluble, helping to neutralize them and making sure that they're not toxic for the bodies. And of course, glutathione is wonderful. It is the supreme detoxifier, I would say, found in high amounts inside the liver and also the gut and the brain. But if you can get in preformed glutathione, usually it has to be done intravenously because it's not very well absorbed orally, unfortunately. Even some of the liposomal preparations are still not. So intravenous glutathione, I would say, is great. And then, of course, vitamin C, which, of course, has been around forever. And we know about all of the amazing roles that vitamin C has. But first, avoid our endocrine disruptors, and secondarily, how to get them out of the body. I think it's a really, really important thing, given this topic and all the relationships that we're now seeing between endocrine disruption and our hypogonadal patients.